Hello and welcome to Cause for Conversation, a Solent Mind podcast where we talk about mental health and wellbeing, featuring expert guests from our services across Hampshire. Today we're talking about communities. Hampshire is home to a lot of different communities, from Portsmouth to Fareham, Winchester and the New Forest. Each community has different needs and experiences different barriers to accessing mental health support. I'm Jenna and I work in the communications and marketing team at Solent Mind. Before we start this episode, why not like and subscribe? And when you've finished listening, please spare a moment to leave us a review or comment, letting us know what you want for future episodes. Solent Mind's strategy focuses on how we can support our communities, and our guests today tell us more about how we're putting that into practice.
I'm Harley. I'm a peer support and wellbeing practitioner with Positive Minds based in Portsmouth, as part of Solent Mind.
My name is Aster. I am the Recruitment and Volunteer Coordinator for NHS Talking Therapies Hampshire.
You're welcome both to the Solent Mind podcast, Cause for Conversation. It's great to have you both. So, communities are a big theme of our Solent Mind strategy. So my question to both of you really is, how are we providing accessible mental health and wellbeing support to the communities that you both work in?
I mean, from Portsmouth perspective, we have, with Portsmouth is so multicultural and lots of different communities. We also have the university as well. So we get, all kinds of people walk in, come in through our service, and, we try to be as accessible as possible. So we have an accessible entrance, so anyone who may use walking aids, anything like that, wheelchairs, they can get in easily, accessible toilets, stuff like that. But we also, we're people who English may not be their first language, so we can offer support through using translators through Language Line, so they can get that support but in a language that they understand, or makes it easier for them to engage. We also have kind of a lot of ways to register as well, so if people don't feel comfortable coming in, they can register online. We also have different appointment types as well, so there's different ways of accessing our service that doesn't involve having to physically come into the centre as well. And I think that's been really, really helpful for a lot of people.
Brilliant. And how about you, Aster, in Talking Therapies?
Well, I mean, as you're probably aware, NHS Talking Therapies covers quite a wide area, so it is a challenge to make sure that we do have that support that is accessible to everyone in the area that we support. We have a lot of the same things that Harley was talking about. So translation services, various different ways you can sign up. So through your GP, self-refer. You can even call up. We have a main line, so you can call and talk to someone who can talk you through that referral process. I think something that we've recently been doing, because most of our support is online or over the phone, is trying to expand that in-person support. Because for a lot of people, especially hard of hearing, or various different sort of accessibility needs, having those appointments in person is so much more beneficial for them. So we've got, a long list of locations now with different sort of in-person facilities and support, so we can offer those, and we're trying to expand that groups that we offer and have those in person as well, so people can really have that sense of community and togetherness, because isolation is such a big part of mental health, and overcoming that can really help with recovery.
And Harley, you run peer support groups at Portsmouth as well, don't you? So could you tell us a little bit about those?
Yeah, so I mean, we have such a variety of groups. We have a SAD drop-in on a Monday, so that's like a stress, anxiety, depression. It's in collab with them. We have a lovely volunteer, Katie, who comes in. We also have a creative writing group, which one of our other peers, Hannah, set up because she used to be an English teacher. We also do various drop-ins for employment support, PIP drop-in. And then on a Thursday, we have an art group, which is very popular. One of our peers, Jane, she runs it, and a lot of people tend to go because she's there. Which is testament to her and how she runs it. And then one of our newer groups is the neurodiversity group we set up a couple months ago. So that runs on a Thursday afternoon, and that's been very popular with our service users. A lot of people come along and realizing it's not just them dealing with the issues of neurodiversity, because obviously often neurodiversity and mental health goes hand in hand. And not a lot of people realize that, and actually having that supportive space has been really helpful for people. And then we also have another peer drop-in on a Friday. That's just a kind of general drop-in. People come along. We have a lot of regulars, we say. They come in every week, and they, it's just tea, coffee, biscuits, chat, being around like-minded people. And we find a lot of people come to a lot of our groups like regularly. They find community here. They feel comfortable. They even meet up outside of the space as well. They make their own friendship groups, and I think it's really valuable. It's certainly, I wish I had this kind of support when I was unwell as well. So I think it's really, really lovely to see that.
That's brilliant. And do you have to be referred, or can you just drop into those groups?
So with the groups, we ask for a self-referral to be completed. That can be done on the phone, can be done online. People can just pop into the centre and just do a referral with someone if they feel more comfortable with that. There's a variety of ways to do it. It's just so then we can, because we obviously share our systems with the NHS, we record who attends, and if there's any issues, if we need to flag anything, it's just for those purposes. But yeah.
Okay, brilliant. And Aster, there's some groups and courses that NHS Talking Therapies offer as well. So do you mind telling me a bit about those, please?
You're testing me now. So in terms of groups and courses we offer, we do have a lot of psychoeducational stuff. So I think the really big one is the Managing Moods group, which is kind of like a toolkit of various different methods you might be able to incorporate into your own life. That you can go more in depth with that, sort of having that one-to-one support with a practitioner on a specific sort of method that you were more interested in or might help you. So we've got one about sleeping soundly. So sleep hygiene, making sure that we're sleeping well is so important for well-being. Makes, I know, a huge difference to me managing my chronic pain. We also have a premenopause group, and that just has been fantastic to see, because I think it's an area that not many people talk about, and actually to know you're not alone in that sort of like perimenopause phase, where there's not a lot of information, to have a bit of information, but also to hear from other people's experiences is incredible and really powerful. So, and I think that's been extended. So it's 2 sessions that sort of like connect and tie in with each other. And we do have employment skills workshops as well, similar to, I think, what they have in Portsmouth. I think we run them online at the moment, but we're looking to have them in person as well.
That's great. You don't have to remember all of them.
I know that there's a lot more that we offer.
Yeah, of course. And again, is that a referral process? So do people need to refer themselves into Talking Therapies?
Yeah, so you can self-refer. So it's the same. We need it for our systems, just so that we can make sure that we are giving people the best possible care, and recording that for other people in the future to know what's worked for someone, or maybe what hasn't worked, so that we don't repeatedly try and make people do the same things. So there is a referral process, but I hope it is accessible. So you can do it online, and if you're struggling with it, you can call up our main line and get some support with doing that referral, or your GP can put a referral through for you.
How do we at Solent Mind tailor our support to the specific needs of our communities?
I think with us at Positive Minds, obviously we have that access to language and stuff like that really helps with people accessing it, especially if English isn't their first language. But we obviously are also aware that, sometimes people walk in, they're very heightened emotionally, a lot of stuff's going on. So we kind of try to accommodate that so we have we call our Barbie room. It's a pink room. It's just pink. We call it the Barbie room. And that has like fairy lights in it, and it has a main light. So we usually turn the main light off, have the fairy lights on. It's a more calming environment. It's a private space. People can, come, and if they need to cry, they can have a cry, and it's not done in front of everyone. They can have that space, that private space to talk. We try to have a lot of low level lighting, low level stimuli where we can, where possible, because a lot of us in the office are neurodivergent as well. So that actually helps us perform better as well as a team. And stuff we always have out, we have a bowl of fidget toys at the front, because we find, like, especially if you're waiting for an appointment, you might get anxious. Like having something a bit tangible could be grounding. We have like a system in place in the neurodiversity group where people, we've got fidget toys about, and people we've got earplugs as well, because obviously a lot of people have sound sensitivity. I know I do. So having lots of different things available, it's been really helpful. And with our facilities, we have gender neutral toilets. We've always had gender neutral toilets, which I think is really great. Makes me feel very comfortable as a trans person. And also I think it's really good for other people as well. Like we have our disabled toilet, we have our the standard toilet, so we have that access if needed. And that's just, it means that more people can access our services, and that's what we want. We want to be helping as many people as we can in the community.
And how about in Talking Therapies, Aster?
We see every type of person you can possibly imagine, being such a wide area and also an NHS service. But I think that one of the key things to do is make sure we're giving people a chance to actually tell us what they need, because everybody's needs are different. So we don't want to say, right, this is what works for everyone. So I think that's something that we do quite well, and just proactively offering like what options we have available, so they don't feel like that burden of, because there's so much shame, I think, involved with mental health, especially when there's neurodiversity and like disabilities. If you haven't had a supportive network around you advocating for your needs to be met and for people to adjust to what you need can be really difficult. So being proactive in offering what is available is one of the things that we try and do.
So would you have, if you were having one-to-one support, for example, would you have an assessment with a practitioner, and then the support would be sort of personalized to what your goals are?
Yeah, so the first sort of appointment, I guess, if you were having sort of one-to-one, is you have an assessment. So this is to make sure that we are the best place for support. And if we're not, making sure that we're having those meetings with other services to make sure that they do get the right support. We don't just say no. But then from that point, in our service, they'd have a practitioner, so one-to-one, if they're having that sort of guided self-help, we call it. The practitioner will sort of build your goals with you and sort of empower you to meet those and remove any obstacles to achieving those goals with you. So it's really working with the patient and being led by them as much as possible.
Great. And Harley, do you have a similar approach with peer support? Is it sort of about working with that person on their goals?
Yeah, so I mean, we like to have, obviously, people to have their own autonomy about what they want to work towards. So if a primary referral, it's more group-based support. So it's coming to the groups that we run, any drop-ins and stuff we run, that'll be the main kind of focus of support. If someone is referred through secondary care, that's when we do the more one-to-one support. And we generally, in the first 1 or 2 sessions, we try to make sure we kind of set out a goal, making sure people are kind of clear about what they want to do. So if that's social inclusion, getting out in the community, getting into groups with support, that's what we can do. Graded exposure. So some people obviously struggle to get out, agoraphobic. So building up their confidence to get out in the community by themselves and actually being able to kind of, travel on the bus or get out of the house. It can be fairly simple, but for us, it's goal orientated support. They come in, we make a goal plan, and we try to work towards that goal. Hopefully we achieve that goal. Sometimes it doesn't happen, things get in the way. So obviously our aim is to make sure they achieve that goal. But even if there's just some improvement, that's still a win in our book, to be honest.
With goal orientated stuff like in therapy, I think it can always be adjusted. Like if they've had something happen that gets in the way of that goal, or maybe their focus shifts, it can move. It's up to them really what they want to get out of that support, isn't it?
It's giving them autonomy, because especially when you're mentally unwell, like a lot of your autonomy can be taken away. So actually being able to go, this is what I've been told that you would like to do. Is it something you'd like to do? Or is it something else? I can then go back to a lead professional and we can discuss it a bit further and say, actually, this is what you want to do instead. Giving that autonomy when a lot of people don't have that, and, you know, being able to advocate for people. That's why I do what I do, you know. So
brilliant. And I was just going to say, so we had an episode about peer support with Becky and Kat, and actually they said that it goes sort of hand in hand. So although it's not clinical, if somebody is accessing professional therapy or more structured forms of therapy, peer support can actually be helpful alongside that, because there are differences. Is that right?
yeah, I mean, with peer support, obviously we're all peers with lived experience, or our own lived experience of mental health. You know, we all have that lived experience. We all bring that to the role. A lot of the time, our service users benefit from a combination of both. They have that clinical input where meds can be, you know, worked out, whether that needs to be adjusted, whether they have therapeutic input. But actually, sometimes people just come to us and they're like, oh, like it's not just me who has had to deal with this, and actually like sharing, you know, to some extent about what I've been through, what you know, how not necessarily I've overcome it, but how I've dealt with it and how I've managed to kind of cope and learn new ways of dealing with things, and life's improved. Like, it gives a lot of people a lot of hope, like, you know, that it's not going to be this way forever.
I think one of the most powerful thing I've seen from talking to our peer support volunteers as well is it's not one directional. You're helping each other, and you've all come from that same place of like, I've needed support, or I'm currently needing support. There's that sense of understanding already established. I think it's really an asset to therapy to have that space alongside, because it really can lift some of those barriers of around being a burden, or feeling like ashamed of how you're feeling, because you know you're not alone, and it is normal to feel these things.
So another of our themes in our strategy is about developing and supporting our staff. How are we making recruitment and staff training more accessible and inclusive?
So this is really exciting, because I've had the opportunity to work quite closely with our people and culture team, specifically talent acquisition, and really looking at this, like how is our recruitment portal working? Is it accessible? And make so you can use it on a mobile, because not everybody has a computer to apply for things. Especially if you are looking for a job, you potentially don't currently have a job, and that makes affording these things really difficult. So just making the actual process itself accessible, but then also in interviews, really looking at what our values are and aligning those questions with those values. So like around inclusivity and accessibility, really having that as part of our process. So we're continuously growing and incorporating all these new perspectives from the moment people sort of join our team. And we have a LGBTQIA plus group, which has a lot of neurodiversity in it as well, and we just support each other within the workplace.
I also wondered about, you know, obviously we want people from all walks of life with all different experience. It might not necessarily be professional experience, but lived experience as well. How are we sort of trying to get out in our communities and find new talent, I guess?
Okay, so we are looking at going out into the community and actually just being at events and having a face, someone to talk to, and actually talk about the opportunities. I recently went to the Gosport recruitment fair, and there were so many people that were like, oh, I don't think I'm qualified for this. And I'm like, it's entry level. Like, you are qualified, because you don't need a qualification. And actually your experience is what's important. And almost pretty much everybody has transferable skills or a way to develop those. A lot of things can be taught as well. So actually having a chance to have those conversations with people and seeing what areas of the job descriptions they're getting hung up on that they don't feel they have, so that we can adapt those to actually make it a bit clearer what that means, so people aren't put off and think that they're not suitable when they are. And also reaching out to, there's a lot of support groups and peer support groups these days, It's been, I think, really popular. Understandably, I think it's incredible that it has become more accessible in recent years. But looking at maybe reaching out to those groups of people with lived experience and saying, we have these opportunities, we have a workplace that is 70% of our staff have lived experience. So come and work with us and bring all that knowledge. It's because there's nothing can replace that. You can't teach that.
Yeah, definitely. And particularly for the peer worker roles, right?
Yes, absolutely. It is one of those things, I think, in mental health, there's a lot of stigma around men talking around mental health. So really as well reaching out to those men's peer support groups, because having men that are happy to talk about their stories and share these things, all of that, it goes so far towards that stigma and like really unpacking it and showing that it's not the case. You're not weak. It doesn't make you any less for reaching out. Is a strong thing to do, and actually everybody needs support sometimes. And I think the best way to do that is to lead by example, and just community groups, having presence, and talking to people. Nothing beats actually being in the community.
What's your experience of working at Solent Mind, and what do you like most about your roles?
From a personal perspective, like from when I joined or when I went through the recruitment process, I actually found out about the role through my friend Sarah, who already works here, has worked here for a while, and she's like, I think you'd be really good at this. Did the application and stuff, and actually the accommodations were instant. I said, look, I have ADHD, I'm looking at getting diagnosed with autism. Is there any accommodations that I can have through the interview process? And they're really good. Like I was told I was having to do a presentation. I was given funny enough, the theme was community. So I made the theme about community. And they were looking at, they gave me the questions in advance, which was really helpful. So, and I was allowed to kind of take in some note cards. I've written some little notes so I wasn't kind of sitting there thinking, like tripping over my words, I'm stumbling, and actually that's been really great. And ever since I joined, I've just felt really welcome, being non-binary. I've never felt uncomfortable with work. Literally, as soon as I said my friends are they, them, everyone was like, cool, that's it, it was sorted. I've always felt very comfortable expressing that. And yeah, I think having that freedom of expression as well within our team as well has been really helpful. I'm in bright dungarees and patterns all the time and have bright hair and piercings but I think that also helps as well for people like our service users to come in and actually go, okay, these are people just like me. It's not just, we're not in suits and ties and, looking very official. And I think that makes it a more welcoming environment for them as well.
I had the same sort of experience coming into the service as well. I'm non-binary as well. And the reason I applied for the job with Solent Mind is because I knew it was a supportive workplace, because I had friends who worked here, and just that's such a huge factor in what I will apply for is whether or not what I know about that organisation already and how supportive they are, because I don't want to work somewhere where I can't be myself.
I mean, for me, it was a bit of an adjustment when I first started. It was quite challenging because I had been out of work for quite a while. I'd actually then been quite unwell previously as well, and had moved 150 miles away back home to be cared for by my parents to make sure I got better. And so it was a bit of an adjustment, especially a 9 to 5. I've never had a 9 to 5. I've always done retail or food, so it's always been 12-hour shifts or stuff like that, or really early morning. But especially in the past, I'd say 10 months, I felt like I have come more into the role. I feel like I know what I'm doing most of the time. Even with some of our new starters we had at the end of last year, kind of took them under my wing a little bit and was like, if you have any questions, let me know. Do video calls with them and making sure that any processes they weren't sure of, we were kind of going through together. Working here, I've always felt seen and listened to. If I have had a difficult conversation with a service user, I know I can go talk to one of my team leads. It's not a big deal, and we'll find a room, we'll go talk about it. And I have accommodations as well. If I'm feeling fidgety or my brain's just not quite, I need 10 minutes, walk around the block or something, I can go do that. Whereas I feel in a different office environment, I would not be able to just get up and walk around and fidget and do weird stretches to get my brain going. I love what I do because I work with such a variety of people, and it's quite validating to actually be able to build up a rapport with service users like trust you with a lot of really deep personal stuff, and a lot of them I'd like to hope come out of here and go, okay, it's not just me, I'm not alone. There is a way out of this. A lot of the time for me in the role, I like to think I'm providing the support to people who are in my position X number of years ago. Like in 2022, it was one of the worst years of my life. And I feel like if I'd had the support that I provide now, I would have dealt with it a lot better. And that's what I try to do. I try to be the support I wish I had when I was unwell. Yeah, I just love it. I do. I really enjoy it. I love my team. I like the people I work with. It's just great.
Brilliant. How about you, Aster?
I want to say how incredibly moving that is. And I guess this is part of my experience as well. It's just hearing the people I work with and their passion about mental health and helping people is just so inspiring. And I know I'm just like sort of behind the scenes, and my strength is definitely not in supporting people directly, but being able to help the people who have those strengths and get them in the right place so that they can support people and see the impact that has. I really love that. In terms of my experience, just sort of as an employee, when I started, so I have chronic pain and I'd been recovering from burnout, which is not a fun thing to try and recover from. It takes a lot longer than you could possibly sort of imagine when you first start that journey. And there's still days where I don't feel 100%, but I've made such progress. Like I'm in a better place now with my chronic pain and fatigue than I ever was. I feel like I get to use my strengths to help the people that help people, which is really nice.
What would you say to someone who's considering a role at Solent Mind?
Give it a go. I've ended up in a place where I look forward to coming into work, and I never used to have that. Everyone's really supportive. We support each other. Being in a supportive environment, where it's understood that you're not going to be 100% perfect all the time. You're going to have bad mental health days, and I think the supportive environment has been incredible for me. I've never felt so supported and welcomed in a workplace, and actually valued as well. My team leads always make sure that I feel valued, that's really, really good for my self-esteem. And I think that's really good as a whole. Like our environment, it's encouraging, it's welcoming, it's warm, it's friendly. It's what I've always wished for on a job.
So Aster, can you tell me more about your work with volunteers?
So I think a lot of our roles in Solent Mind as a whole is peer support roles. And I think the peer support roles, especially those people who have reached that point in their mental health journey where they're looking to sort of pass it forward. And the feedback that I hear from the peer support volunteers that we have is that it benefits them just as much as it benefits the people that they support. It's very much two-way streets because it is, for a lot of people, a really important part of their recovery, as well as getting that chance to give back. We also have a few various different events that people can get involved with, but then also we have a few admin roles in NHS Talking Therapies. It's just really nice getting to work and be part of that change.
And shout out to our volunteering lead, Michelle, on my team, because she's doing a fabulous job, and our volunteer coordinators in the different areas as well, obviously working in service. So if people want to volunteer,
so the best thing I think you can do is if you go onto the Solent Mind website, you can register your interest to volunteer.
Great. Are you looking for any volunteers in Portsmouth at the moment, Harley?
Yeah, so we're always kind of trying to be on the lookout for some volunteers. There's actually a course I run called the Decider, it's a skills course that it's been passed down to me to look after, and that's a 6-week course, and we looking to have a volunteer to help with that, help teach it. We're looking into getting an 18 to 30 group set up as well, so potentially volunteering opportunities there. Also looking at setting up a menopause group as well. So similar to what's obviously already available with Talking Therapies, but again in our own capacity, and having hopefully some more lived experience, because a lot of us are not at menopause age in the office. So having volunteers come in is really vital as well to us. So we're always on the lookout for more, and actually again, using lived experience is really helpful for other people as well.
Yeah, I think you both sort of highlighted how that can be useful if you are between jobs at the moment, or you're not working for whatever reason. Coming in and volunteering can actually give you a bit of routine, help you build those skills, as you say.
A lot of people that I've seen come into roles with us anyway already have a lot of skills, but it's just the confidence that to believe in themselves that they do have those skills, so that they can then sell those skills, like to be like, yes, I do have this, I am a strength. Because being able to talk positively about yourself is such an important part of getting a job, and it's not something that people are often, I know I'm not comfortable with it, and being able to build that confidence that actually what you do and what you know is really great, and it is an asset to any place that you work in, and knowing that is really powerful. But for some people it's just that sense of community and having people to talk to.
Yeah, I mean, prior to actually coming to Solent Mind, I actually was a volunteer for a charity, and I was helping people who have disabilities, or whether that's physical, whether mental health issues, stuff like that. And it was adapting, like basically making cycling accessible for all people. So that really built my confidence up, my people skills up. Building those skills, as you said, building that confidence, it was really vital, and I think that's part of why I got the job I've got here. I don't think I would have got here without that experience. Feel like you're contributing, because you don't want to, I don't want to always be locked away in my room when I'm unwell. So yeah, I think that was really helpful. I'm just very thankful for the job that I get to do. Like, if you told me 3 years ago, this time 3 years ago, that I'd be in a role that I love and I can live, independently in my own flat. Never had rented my own flat before. I rent a flat now. I pay my own bills. I see people outside of work. I social, like having a life again. It is possible, and I'm really thankful for that. I'm just thankful that I got through it and I'm here, and yeah, just living life.
It's been so lovely to chat to you both, and to hear, Harley, what is happening in Portsmouth and the Portsmouth Wellbeing, because I know that the wellbeing groups do so much good work. But the same for me as well. If you told me this is where I would be 3 years ago, I would not have believed you. So very grateful for the opportunity.
Brilliant. And yeah, Aster, would you say if somebody came to a job interview and had volunteered somewhere, that would be something they could talk about?
Absolutely. And I love to hear people's examples when they're volunteering, because I find that they're always so much more varied as well. Like the things you can do and the impact you can have as a volunteer and the real growth you can see, they're all such strong examples you can use in interview questions, because being able to, anybody can say, oh yes, I'm really organized, but to be able to say, actually in this setting, this is the impact I had and this is what I've done. I highly encourage, if somebody does volunteer, to bring that into your interviews, because we love to hear it.
Just a quick one as well, I always ask my guests this. So what do you both do for self-care, or what do you do to manage your well-being?
So I have a big fluffy dog called Roxy. She's a Newfoundland, but she is vital to my well-being. I've had her since she was 2. She's now 9 this year. We've been through the ups and downs together. So I was going on a walk with her, helps clear my head, being out in nature, that really helped. I also do a lot of reading. I'm up to 28 books this year so far.
Wow.
You say, wow, I'm behind schedule. Goal is 75 this year. And I also do a lot of roller skating. Really love skating, really enjoy it. I have a really lovely group of friends that we skate together, have a great laugh. It's just a lot of fun to get to travel to places. That's so vital to my well-being as well. Unfortunately, at the moment, I'm off skates because I have a knee injury. But the community with that is fantastic as well. Having community in your personal life and your work life, that is really helpful, and that's been vital to my progression. Being able to actually come back to full-time work, being able to give back to people that are in my position that I was in a couple of years ago.
So recently, actually, I've started running. I never thought I'd be a runner. That's I hated it in school, but I think since having chronic pain, there was a point in my life where I struggled to even stand up. So to be able to exercise, I just feel really lucky to be able to do it. And I find it really helps with my anxiety to get that stress out of my body and going running outside and just enjoying the sun, the fresh air. And I love gardening as well. I've been going to Mayfield a lot. Wonderful, wonderful little place. They've got really good pastries as well. I had there's an apple crumble, like a cinnamon roll, but an apple crumble roll, and it was really good. But they've got amazing plants, so I've been trying to fill my garden with flowers and colour. We get loads of pollinators now, so I'm really enjoying that. It's bringing me a lot of joy. And and creative hobbies. I find making things to be always so satisfying to like really see, like I've achieved something and it's in front of me. So recently I've been painting some miniatures. I don't know if you've heard of Warhammer 40k. Yeah. So yeah, I just recently finished painting up my Curse City box. So that's part of the Warhammer franchise. And started running a new campaign with my friends. So which is really fun and really nice to get them involved in my hobbies. Just eventually gonna get everybody involved with Warhammer. I think that's
I got recruited into Dungeons and Dragons.
Yeah, I think Dungeons
I love it.
of Dragons will be next for me.
Dungeons and Dragons is really fun. I also bake a lot as well. So
Nice.
that's my creative outlet.
I think
a lot of the office do appreciate it quite a lot. I get requests a lot. One of our team members, she's just gone on maternity leave, and she's just had gestational diabetes. So I made a diabetic friendly carrot cake for her.
Oh my goodness, that's amazing.
She said that was lovely. Yeah, I love baking. I do.
Thanks again to Harley and Aster for being such great guests, and of course to everyone listening. And if you've tuned in this far, please leave us a review or comment to keep the conversation going.